Hi, it's Jen from Embrace Dental Hygiene. How's everybody doing today? I wanted to talk just a little bit about tooth decay because so many people have it, so many people experience it, and so many people don't realize that they are the ones that are in control of preventing it or allowing it to continue to happen. Nobody has bad teeth. It's very rare that there's a genetic or developmental defect in the enamel. Those people are maybe 1% of the population. I'm just spitballing. It could be a little higher, it could be lower. But basically we are all given tooth enamel, and enamel is the hardest surface in the body, and it basically demineralizes and remineralizes every single day with everything that we eat and drink. But there are three factors that need to be in place in order for tooth decay to take place. There needs to be a tooth, which we all have. There needs to be bacteria, which again we all have, and there needs to be food for that bacteria, which is what we eat and drink. Certain foods obviously are metabolized easier by the bacteria, and certain foods are actually mechanical and help disrupt the bacteria. A susceptible surface, which is the tooth, and then time. Okay, the bacteria needs to be in contact with the tooth for a period of time. So what we do when we're brushing and flossing, your hygienist, your dentist, they all tell you you need to brush and floss. You don't just need to brush and floss, because if you're brushing and flossing every single day faithfully and you're still having tooth decay, then you need to change how you brush and floss, because what you're not doing is disrupting that bacteria. It's staying in the areas where you're experiencing decay. So you need to look at modifying it. Use your hygienist, use your dentist, how you need to modify, whether it's an electric toothbrush, whether it's technique, whether you need to just spend more time brushing, change the time of day when you're brushing. These are all factors that affect whether you're going to experience tooth decay. The other thing is what you're eating. The more mechanical, the more fresh, crunchy, your fresh fruits and vegetables, those are your ideal diet, even for health. It matches with tooth health. It's the same with your physical health. Fresh fruits and vegetables are the least metabolizable by the bacteria. And it's also mechanical. When you're chewing it, it's disrupting the bacteria itself. Things that are really chewy. The worst thing that you can do is consume liquid sugar. It doesn't even have to be sugar. It can be energy drinks. It can be wine. These things all have something that the bacteria basically metabolizes, creates acidity. In the areas where the bacteria sits, this acidity will eat through the tooth, and that creates decay. So liquid sugar washes over the entire tooth, the entire mouth, finds every single surface. That's why it's the worst. Even candy that's somewhat chewy, you eat it and then it's gone. We don't consume a juice box or a beverage in a two-minute period. You usually consume it over a 5 to 10 minute period. So the teeth are consistently being bathed in that sugar, and the bacteria is eating it and creating an acid. It's an acidic process that destroys tooth enamel, leading to decay. So if you eliminate liquid sugar, if you improve your brushing and flossing, without flossing, you're going to get decay between the teeth. The bacteria accumulates on all tooth surfaces. Brushing accesses the flat surfaces, the biting surfaces, but those spaces in between the teeth, your bristles or your brush don't get in there. So without a flossing habit or some kind of interproximal cleaning, there are flossing helpers, there are floss wands, there are air flossers, water flossers. Talk to your hygienist, talk to your dentist, figure out what works for you. The other thing is you can always add products that are going to make your teeth more resistant, that are antibacterial, whether it's a mouthwash or a toothpaste. These are all things that you can talk to your professional about. If you're interested in getting a customized care plan that's going to eliminate your risk for tooth decay, that's going to stop you being diagnosed with cavities, and the destruction of that tooth enamel, get in touch with a health professional or me. Like I said, I'm Jen from Embrace Dental Hygiene. I have a website, embracedentalhygiene.com. You can email me at jen@embracedentalhygiene.com. I'll ask you a few questions. We can get you started on changing what's going on in your mouth if that's something you're interested in. You have the power. we don't go home with your teeth. So we can't eliminate tooth decay for you. We can guide you. We're a tool and a resource for you to use. It's your choice on whether you choose to make those changes or if you want to live in how things are going now. If you don't make changes to what you're doing, you will consistently have the same issues. That's just the way it works. And also, you can give me a call if you're interested, 519 736 1100. I can help you make those changes. Thanks.